And just so everybody knows, our speakers included, we are recording the session, and we're going to end up sharing it. So if there's something off the record that you don't want shared, just make sure you don't say it or let us know. And but generally this will be open, even though we've kind of closed it to the public in terms of the actual call itself. We're going to be circulating it more broadly, so just be aware of that. And let's see. So I'll go ahead and start. I am Trevor Williams. I think most of y'all know me, but if you don't, I'm the managing editor of Global Atlanta. So we're a news publication. So if I ask too many questions, that's why. I'm a journalist. And we cover international business here in Atlanta, international affairs. Really the gist of our publication is looking at how Atlanta is affected by the global economy and vice versa. And so this sort of series looking at different aspects of Atlanta's and Georgia's engagement with the world is right up our alley, and why we've decided to partner with Pendleton on this. So yeah, the thematic link through all these, even though we're doing different industries and topics, is the idea of reframing resilience. So it's kind of envisioning the future of engagement with the world post-pandemic in various aspects. And we decided to take a more conversational approach that Guy will tell you about a little bit. I'm going to hand it over for now to Jorge to just tell us about the Pendleton Group and a little bit more of the rationale behind hosting these meetings, and then Guy will give us more thoughts on the format and how we should go ahead.
Okay, great. Hey, Guy, if you could send to Ani the password or the meeting, he's asking that. Good morning, everybody, and I'm Jorge Fernandez. Just a little bit, I'm with the Pendleton Group, and first of all, it's a great pleasure. This gives you a sense of normalcy, sort of come together with our partners, Guy Vessler, who's going to talk to you in a second, also from the Pendleton Group, and Lauren, also from the Pendleton Group, to partner with each one of you to have an engage on this topic in this dialogue around global connections in the healthcare innovation space. Both Guy and I, specifically with the Pendleton Group, focus on the international side. And what we do, I guess we could describe ourselves, or the best way I could describe it is that we're a force multiplier, if you will. And what we'd like to do is to connect businesses and municipalities, location organizations, to a network of expert influencers that can impact everything from business strategy to economic development, partnership development, and public affairs. And best way would be to learn a little bit more of our team. At our website is pendletonatlanta.com. And it's great to partner specifically with John Parkinson, a good friend of mine from previous lives, if you will, from Pendleton Booth, and with Trevor from Global Atlanta, has been a partner of International all along, the same thing as John. So with that, I'll turn it over to Guy and talk a little bit about the expectations for today.
Thank you, Jorge. And this is our second in this Reframing Resilience conversations, and indeed we want it to be a conversation and kind of look at different topics that influence our current state and where we're going forward with it. I think that for those of you who participated in our first one, it was definitely kind of a refreshing format to actually engage with people as though we're talking to each other. No one is at higher hierarchy than the others. You basically don't have to raise your hand to perhaps be heard. Although don't go full Israeli and barge into each other, but still it's as though we're sitting around a round table or a square table, wherever, and debating, learning from people who are in the midst of the subject matter of that topic, and having conversations with them, as well as bringing our own experience. So it's not necessarily about questions and answers, but it's about conversation around this topic that we have chosen today. And Trevor, take it away.
Sounds good. So what we did the first time, and it went a little bit long, we're going to try it again, and we're going to actually try to hold you to the rules here. But we did introductions for each of us and tried to keep it to the one breath rule. I think a lot of folks took 2 or 3, inhalations, took it a little bit far last time. So we're going to ask you to just keep it very brief, who you are, maybe your organization, and then maybe as we go, it'll be more evident as to why you're here and what perspective you want to give. We certainly want everybody to have time to speak when they have something to say, but I'm just going to call on you and maybe just tell us, why you're here, what your organization is. Just keep it very succinct. There's one person, I can't see your name. It says USCASCAR. I'm going to call you out first and just tell us what your name is.
Carlos Castilleja.
Okay.
Work for Electa Medical Systems. We do radiotherapy around the world.
Great. Thanks, Carlos. Carrie Ann.
Thanks, Trevor. I'm Carrie Ann Jones-Parr. I am the head of the UK Science and Innovation Network here in the Southeast. I'm essentially a science diplomat.
Nice.
Between US and UK.
It's a great thing to have on your business card. I like it. So would you like to introduce yourself to Song as Global Atlanta's event engagement intern?
Yeah. Hello, everyone. Good morning. I'm C Song. I'm the events intern, and Trevor is my supervisor. I'm also a grad student in global media and cultures at Georgia Tech. Nice to see you.
Thank you so much. Joseph?
Hey, good morning, everybody. I'm Joseph Hunneman. I'm project manager with the Georgia Department of Economic Development. As I think most of you know, we're the sales and marketing arm for the state, looking to bring jobs and investment here to Georgia.
Great. Jesse, why don't you go again? We had decided we were going to, let the people who had participated last time sit in the background, but I think since we have so many new people, it makes sense to go again.
Sure. Well, I'll be very brief. I'm Jessie Jenkins with World Trade Center Savannah, and I'm the Director of Research and Trade Development here.
Perfect. Julie?
Sure. Thank you, William. So I'm Julie Lambot, and I'm the Executive Director of the French-American Chamber of Commerce in Atlanta.
Jacobus?
Jacobus Boers, Assistant Dean for International Engagement in the Robinson College of Business, Georgia State University.
Nice. Maddie?
Good morning, everyone. Thanks for having us here today. I am Maddie Cook, Trade Commissioner for ICT Technology. I'll take Carrie Ann's note, Diplomat for Technology, connecting Canada and the Southeast US.
Carrie?
Hi, everyone. I'm Carrie Barnett, Healthcare Trade Specialist for the United States Department of Commerce, United States Export Assistance Center here in Atlanta. Thank you.
Peter?
Hi. Good morning, everybody. My name is Peter Zimri. I'm the Consul General of Switzerland, and thank you very much for having me.
Right. Regina?
Oh, I'm Regina Maddox, Executive Director of Next Generation Manufacturing, and I'm happy to be here amongst all these very interesting people. Our organization connects manufacturers for the sharing of best practices, innovations, and resources, and we're very happy to partner with Global Atlanta on a number of things, and
awesome.
Thank you for including us.
No problem. Lauren?
Hey guys, I'm Lauren Lackey, and I'm Project Manager with the Pendleton Group. Happy to be here.
Great. Lucia?
Hi, I'm Lucia Jennings, and I cannot hide that I'm the President and CEO of the Brazilian American Chamber of Commerce.
Great. Prabhu?
I'm Prabhu. I'm a career diplomat with the Government of Canada, currently on my rotation in Atlanta, serving our interests here with our most important trading partner in the United States, and I'm happy to be here.
Right. Ani?
Yeah, hi, I'm a diplomat for science and technology for France here in the southeast of the United States. So I'm here to build partnerships in science, technology, and new generation entrepreneurs.
Okay, so Rami and then Ani Agnihotri.
Yeah, Ani, I'm co-founder and CEO of Marshall Automation America, an advanced manufacturing company, as well as co-chair of US India Business Summit.
Great. Tamir?
Good morning, everybody. What a great group you have here, Trevor and Jorge. I'm Tom Erkaviskill, Georgia State University, where I teach international business and also direct the Cyber Center, Center for International Business Education and Research.
Perfect. And so we've got Ben Harris. Hey, Ben.
Good morning, everyone. Ben Harris with the Metro Atlanta Chamber. I lead our bioscience, supply chain, and advanced manufacturing practices.
Great. Elizabeth. Still muted, Elizabeth. Maybe I can turn you on here. Hold on. All right, well, I think you got it now. No? Okay, we'll come back to you. Zachary?
Hey, good morning, everybody. I'm Zach Burkew. I'm the Site Director of Interventional Radiology at Emory University Hospital, Midtown. I normally would be directly with you, but as with all things clinical, we have emergency cases that are occurring simultaneously. But thank you I do a lot with medical device design and innovation education between Emory and Georgia Tech. And I'm a course leader of a residency track to teach medical device innovation. But I'm going to try to stay with you as long as I can, you know, with everything going on here.
Well, you've got more important things to do, so you know we'll take what we can get with you, but we understand completely. Elizabeth, back to you.
Yeah, I apologize for that. I have I'm using my other half's laptop because I'm not allowed Zoom on our work laptops. So I'm Elizabeth McCargo. I work for the UK Department for International Trade. I'm based in the British Embassy in DC. I head up our life sciences and healthcare sector. I cover 13 states along the Southeast and Mid-Atlantic regions, and I help US companies that are looking to set up in the UK and vice versa, UK companies that are looking to set up in the US in the states I cover, Atlanta being one of them, and I work very closely with my colleague Carrie Ann and the team there in the Consul General. That's me.
Maxine?
Hi, everyone. Sorry, I jumped on a little late. I'm assuming we're doing introductions.
Yes.
Actually just got off another webinar that we were hosting. So hi, everyone. My name is Maxine Beer. I'm an international trade manager at the Georgia Department of Economic Development, and I cover the healthcare and life sciences sector for our department. So we work with Georgia businesses, helping them grow their exports and expand their international reach. The state of Georgia has 12 international representatives located all over the world. And actually the webinar I was just on was our Brazilian trade representatives were hosting a webinar on the Brazilian healthcare market and opportunities for Georgia companies right now and current trends, especially in telemedicine and telehealth. So happy to be here today. And yeah, thanks, Trevor.
Great, thanks. Manori? I don't know if you can.
Yeah. I'm here. Sorry.
Okay, it's okay.
My name is Manori De Silva, and thank you for the invitation. I'm the president of the Netherlands American Chamber of Commerce here for the Southeast. And we do have some people in our membership who are involved in the medical device supply chain. Thank you.
Nice. And Maria, I think you're our last, two more. Maria? I don't know, maybe Maria's muted for a reason. I'm not sure, but Alexis, why don't you go ahead and we'll come back to Maria.
Hi, I'm Alexis Rowe. I'm currently working on an asset mapping project on mapping the world's health resources by chronic illness through a company that's going to be formed called the World Health Collective.
Cool. And we'll just ask Maria one more time, but if she's not available, we'll just go directly into our speakers. Okay, all right. I think she's busy. Okay, so we have some really all-star guests, I think, today. If that's just the participants, I mean, this is a pretty amazing call already. You know, I was hoping that, you know, the publisher in me was hoping that we could, you know, blow this out and invite, you know, hundreds of people to this, because I think the conversation will be that important and engaging. But you know, the format here I think is worth it. But we've got 4 kind of featured guests. Again, like Guy said, no hierarchy here, but we're going to feature them, have them discuss their particular roles, and I'll let them introduce themselves and maybe just tell us about your organization and how you kind of connect with the global economy. Maybe that's a good way to start it, and start with maybe Tiffany. And you're muted, Tiffany, so you gotta unmute. Yeah.
Thanks for the invite and for being here. It's great to see everybody. Hi, I'm Tiffany Wilson. I'm the CEO of the Global Center for Medical Innovation, GCMI. GCMI is a not-for-profit organization. We're an affiliate of Georgia Tech. We opened about 8 years ago with the goal of shepherding the innovation that's happening in our healthcare systems and academic research universities into successful startups that can create jobs and attract investment to the region versus having those innovations spin out and end up in the Northeast or the West Coast. So today we've got about 60 people on our team. Our expertise is really in the design, development, testing, training, and commercialization of new medical products, which it includes medical devices, diagnostics, digital health, and drug delivery tools. And as it relates to the global platform, we are the global center, starting off very much focused on the Southeast, but over the past 2.5 years have been building new collaborations, starting in Israel with a large healthcare system there, really serving as a virtual bridge to bring promising Israeli medical technologies, helping them have a focus for the US market earlier in that process and bring them here. And then we've received interest in that model from other countries as well, including plugging into the medical device manufacturing sector in Latin America.
Right.
So that's where we are from a globalization standpoint right now.
Perfect. Ken, welcome. Thank you for joining us. I think your organization may be the newest one that we're talking about here.
Yes, and thank you, and good morning, everyone. My name's Ken Berta. I'm the Executive Director of the Global Health Crisis Coordination Center, which stood up about March 15th, I believe, right in the middle of this crisis. We're part of a larger nonprofit, the Global Center, or the Center for Global Health Innovation, which is a combination of several existing nonprofits in the Atlanta area. I spent the last 10 years at Philips Healthcare, where I've started working with the Emory team on launching the Emory Innovation Hub, and worked with Dr. Berku, who's on this call, to look at how Emory innovations can be married with some of the Philips innovations to push technology forward faster. And in that process of working in Atlanta, came to meet a lot of the organizations that are here to understand what a center for global health Atlanta really has become, and driven by the CDC. So in working with the CDC and the CDC Foundation, the GHC3 is focused on working on both the response and the guidelines that are developed to look and see if there are gaps in that delivery. And I'll talk about some of those later today. But our organization is focused on leveraging the private sector, a lot of our big corporate partners that I can go through with you, to move both their planning and insights and capabilities against the global health crisis we see internationally. And we're working in, I think, about 14 countries already.
Wow. Barbara, you're representing sort of, and Bruce as well, but Barbara, why don't you start? You're representing kind of the corporate community. You're representing Sigvaris. Why don't you tell us more about the company?
Thank you, Trevor, and thank you for inviting me, and I appreciate being part of this. So thank you. I am the North American CEO of the Sigvaris Group. Just to tell you a little bit about Sigvaris Group, it's a 100% family-owned business based in Winterthur, Switzerland, which is just outside of Zurich. The company was formed 150 years ago, actually a little bit over that. And our main products are we develop, design, and market medical compression garments, primarily for people, to help people improve their venous function, and also venous-related conditions. In terms of the company itself, our headquarters, as I said, are in Switzerland. We have 4 country groups, and North America is based here in Peachtree City, Georgia, so just south of the airport. And we also have production plants across the world in Switzerland, France, Poland, the US, and Brazil. So a very global company. What we really believe in is, we believe in the Swiss heritage and craftsmanship, and we put that type of quality into our products. We have over 1,700 people that work for us across the globe. And, our goal really is, as a medical device company, our goal is to help support patients who have venous disorders, lymphedema, and other disorders that our products can be used for. So many of you may be aware of compression for more personal use as well. They can be very helpful in terms of your day-to-day life, at work, on long-distance trips, sports applications, etc. So there is a consumer side of our business in addition to the medical applications that we have for our products.
Perfect. All right, and then Bruce, your other company representative here. Tell us a bit more about Serenity.
Yes, well, thank you, Trevor, and good morning, everyone. I'm really honored to be a part of this esteemed crowd and audience, so thank you. I am Bruce Lavin. I am the Chief Medical Officer for Serenity. My background as a physician had previously been in drug development and digital health, where I worked at Sanofi, Novartis, and more recently at UCB. Serenity is a relatively new company. It's now about 6 years old. It is a French-based company based in Paris, where Atlanta is our new headquarters for the Americas. As a company, our responsibility really is digital and remote health. And we began as a manufacturer of wearable textile diagnostic devices, primarily in the areas of epilepsy, neurology, sleep disorders, and cardiology. We have since expanded to include diagnostic services, where we provide remote diagnostic services in the clinic, in hospitals, and even in the patient's home. And we are also an aggregator and generator of digital health data, where we are using data in terms of analytics to create AI and machine learning platforms for predictive diagnostic analysis to help in targeted medicine. Our focus really has primarily been in remote health, and that is how can we bring diagnostics to areas of limited resource throughout the world. But more recently, due to COVID, we can consider areas affected by COVID as being limited resource, because a lot of non-essential services have really been stopped or delayed. So how we can bring remote diagnostic devices and services to patients' homes to avoid having to come to hospitals and clinics. So very much how we reinvented ourselves in looking at new technologies.
Great, and that's a perfect way to start on the next question. I'm very quickly getting over my head in terms of my knowledge of what each of you do. But I think if I ask you directly, how maybe Bruce, why don't you start, since you sort of kind of transitioned us that direction. We obviously the response to COVID is both an acute, quick, emergency, urgent kind of response that you have to deal with as a company or as an institution. But then you also have to meld that into what your longer term plans are, and how these adaptations that you've done are going to be influencing your operations going forward. So could you kind of walk us through that? Like what specific response did you make that's related to to COVID, and how do you think that's going to impact your longer term operations and what you do?
Sure. So I think starting with that last comment that you made in terms of how we're changing our operations, and this will be no doubt a topic of conversation amongst the group, but I think we, as many other companies, have seen COVID really change the way we practice medicine and how we do business. And I think to a degree, as we talk about returning to normalcy, or at least the new normal, I think in many ways the new normal is going to embrace some of the things that we were forced to do in COVID as a result of COVID, and that is, how do we rely more on remote digital technologies to bring services to patients? So we looked at really our core strengths, and our core strengths were the development of remote diagnostic devices, and recognizing that patients who needed EEGs and EKGs and sleep studies were not able to come to the hospitals and clinics because they were either closed or inundated with COVID patients. So we found ways to bring it to their home and to be able to provide the same diagnostic services remotely through the internet or through cell lines in a very secure way. And one of the things that we've seen from a technology standpoint is more and more is now being healthcare friendly. Zoom is an example, as we have HIPAA compliant Zoom engagements. So it was our remote diagnostics, our remote services. But we also had to realize that we had to establish and create a platform that would not only get us all through COVID, but to really represent the new way of doing medicine. And that was, we really had to build a telehealth and telemedicine platform and capability that would allow the transfer of diagnostic data. So over the previous months, we actually built a telemedicine platform that would allow tele-EEG, Holter for patients at homes. And what we've done is now we've expanded that to areas that are represent limited resources. So we are setting up virtual clinics in Latin America, in the Caribbean, in Asia, in Canada, throughout rural US, where patients who previously did not have contact with specialists can now interact with specialists. And it was really because of the need to overcome the COVID isolation, if you will. But the beneficiaries really now we found have been individuals that actually lacked access to specialists. And then finally, what we did was we repurposed some of our manufacturing, and recognizing that we make textile wearable diagnostic devices, we easily were able to transition some of that manufacturing to masks. So now we are actually one of the largest producers of masks in France that we're making available globally. We have on our staff respiratory technologists and technicians who were involved in doing our sleep studies, who now have volunteered or recently volunteered to go to New York City, to go to California, to provide technical support as respiratory technologists in the ICUs when they were with COVID. And then lastly, in our sleep studies, in our sleep work, we tend to rely on devices for sleep apnea called CPAP devices. And what is we've worked with the state of New York and other areas to find ways that we can actually repurpose these CPAP devices to serve as quasi-ventilators, if you will. So we found that we really needed to reinvent ourselves to meet the challenge, and this reinvention is probably going to be long-term in the way that business we think will be conducted as far as healthcare goes.
Yeah, that's great. It's interesting. So you have sort of, lines of your business that were, completely in line with the way things were moving, but also you had to pivot to do some different things as well. Barbara, tell us a bit about how that worked for Sigvaris. I mean, you've got such a distributed global manufacturing platform, throughout the company. But were there any acute ways that the Peachtree City, North American headquarters had to respond, and how will that affect your longer term operations?
Sure. So, I can just tell a quick story. So on March 24th, I'll never forget the date, I received several very urgent calls from healthcare facilities across the country asking if there was any way we could possibly make them any PPE, because they knew that we were a textile manufacturing company. We have a knitting facility here in Georgia, and we also have a sewing facility. So they were desperate. They said, you know, is there anything you can do to help us? They were having extreme difficulty sourcing PPE, specifically face masks at that time. So we started a project, and really the only reason we started it was to donate face masks. We knew that long term we couldn't compete with China. You know, there's no way that we could make you know, these non-woven, very, very inexpensive face masks here in Peachtree City. But we wanted to help, and so we gathered together a team. There was 5 of us that worked every day. We met like a sprint and put together a development project, and we quickly pivoted in that project. We realized that we couldn't get any non-woven face mask material. There were no suppliers, no one was available. It was gonna take 6 months to get the supply of the material. You know, we have sewers and we could have made them and designed them, but we could not get the non-woven. So we pivoted at that point and said, well, we can at least make knitted reusable cloth face masks that can help people maybe that aren't on the front lines at the hospital, but help people that are having to go into the hospital as patients and give them some face covering that would help them. So again, this all started as a donation process. Being a medical device company, I've been in the industry for over 30 years. I really believe in giving back. That's why I'm in medical device, because even though we're on the business side of it, we really are a partner to our healthcare facilities and finding ways to help them through crises like this. So we started making them, and within really 7 weeks, we were able to go from design, testing, manufacturing, building inventory, and launch. Never in my career have I launched a product from start to finish in 7 weeks. So you talk about long-term positives that can come out of a difficult situation. Our organization now knows that we can develop products a lot faster than we used to be able to. So that was a great outcome. And then once we started to make these products available, word got out, and we had a number of companies that asked us if we could supply these reusable cloth face masks to their employees. So we've been able to do that. We also started selling them to our existing customers, who are now selling them in their durable medical equipment stores and really in pharmacies across the United States. So we're really, you know, kind of, this project evolved for us and changed course a number of times, but I think overall there was another really positive outcome to this project. In addition to us being able to develop a product fast, our employees, it gave them something to really rally around during a time that was very difficult. We had kept our production facility open. We were considered an essential business, and so we had to find ways to keep our production facility open according to CDC guidelines and maintain a safe production environment. I'm very, very pleased to say that we never had to shut down since March. And our employees had to come to work. And at a time when a lot of people had the luxury of staying home and staying in their home offices and doing their job remotely, our production people could not do that. We still had customers that needed lymphedema garments, that needed compression garments, and we still had to keep making them and keep producing them. So for us to have this as a company to rally around and feel good about was another outcome, I think, that came out of this, that we didn't intend to yeah, as we started out, but has been a real positive for us as a company.
Perfect. Thank you. That's really interesting. And I'm sure Regina, who's on the call, who deals with manufacturers all the time, has a lot of interesting similar stories about how companies have rallied to stay open, keep everybody safe, and innovate at the same time. I wanted to bring in Tiffany. You know, you talked about your cross-border partnerships that you've had, but also I saw that, you know, Georgia Tech was involved in, you know, churning out face shields and kind of 3D printing and all these different things that were very much related to this crisis and trying to keep people safe. What was GCMI's role in that?
Yeah, so I also got an urgent call in March 19th. I got a call from a physician from Children's Healthcare of Atlanta who had been working with a professor at Georgia Tech. She was very concerned because she saw the shortage in PPE staring us all in the face, and had been working with Dr. Saldana's lab at Georgia Tech to design and 3D print a new face shield design. Reached out to me to see how we could help scale it, because you know, products aren't necessarily developed within a university environment, and GCMI sits in between kind of the market and the university to help those projects and prototypes turn into actual products that can be regulated, that people will buy. And so it was like around noon on the 19th, and by 7 o'clock that evening, we had a call with our team at GCMI, Georgia Tech, GTRI, NASA, and the Army around two main work streams. So one being face shields, and the other one being a new N95 mask. And so the Dr. Newton from CHOA and Dr. Saldana, and then Dr. Emily Blum from our team went through various iterations, quick iterations to optimize the design for the clinical environment. And then, you know, one thing to note is, you know, there's a lot of talk about 3D printing, and one of the challenges with 3D printing is it's great for rapid prototyping, but it's not rapid manufacturing, right? And we are talking about medical devices. So it's regulated, and we work closely on a weekly basis with FDA as the guidelines changed. And starting with face shields, it's much lower risk, and there were certain guidelines that were lessened, the controls around them. But we still, in order to have an impact, you know, not everyone with the 3D printer can be a medical device manufacturer. And so essentially our team has come from industry, so places like J&J, Abbott, Bard, where this is what they actually did, kind of take products from design through manufacturing transfer. Normally we help innovators and startups do that, but since we had the expertise on our team to do it, we just did it. And so in 2.5 weeks, we moved from a 3D printed model to injection molding and mass manufacturing. So it was really around that rapid innovation, the collaboration with these different organizations that we had never worked with before. I still don't know what some of these people look like. I just know the sound of their voice. But, you know, I'll echo Barbara's comments, like we are all in this industry to make a difference. And this I had the same experience with our team. This gave us something that we could be passionate about, that we could use our platform to make that difference. And so from 2.5 weeks after we got that call, we delivered our first 2,000 face shields to Mount Sinai, New York, in collaboration with Delta Airlines. Today we have manufacturing set up in South Carolina and Kentucky. We're in the middle of fulfilling a FEMA order right now. And but what's been a neat lesson learned is and an opportunity, I think, for our region is as supply chain, there's an interest in moving supply chain from China, from Asian to North America, Central America, where it's shorter distances. And so we can address these things in rapid order. And so we're seeing new industries collaborating together, new supply chain. You know, we're working with automotive manufacturers who are used to very high quality, high regulations, ISO standards, and they're following our quality plan. So we're putting that in place. So it's been really fascinating, I think rewarding to see how all of these different groups came together in a crisis to make a difference.
Yeah, definitely. And Ken, that's a good segue to you. I'm going to ask you to kind of keep it a little bit brief, but so we can get everybody into the conversation. But tell us about, you know, GHC3 and why it sort of, it seemed like the timeline was a bit accelerated to get this sort of private sector and in some cases public sector collaboration going for the purpose of showcasing the Atlanta Global Health Hub here.
Yeah, I mean, we came in, there had been several years of planning on how to develop this, but we came in with the, you know, the barn on fire on how to get this moving quickly. We jumped right into critical equipment and supply chain and logistics, similar stories to what you have heard here, working with 6 states. And our corporate network is very large. So it's the Verizons, Microsoft, Dell, UPS, Delta, Amazon. We have a very big partner organization on the corporate side. And with the support of the Metro Atlanta Chamber, we were able to combine even more to that growing list to find how we can make connections to what would become an alternative supply chain. Once FEMA got involved in moving the stock that was in the US around, they quickly consumed a lot of UPS's flights to be able to get and move equipment. So we had to step back and you know, a lot of the CEOs had contacts overseas. So we built a small supply chain group out of South Africa, in China and Taiwan, to look at how we could get product over here with some freight forwarders that we had worked with, ways to clear customs quickly. A team with the American American Hospital Association to vet those PPE, ventilators, those kind of things that we could find over there. In some cases, we found equipment that only had the CE mark, so we'd have to move that somewhere else. That's where I got to meet Liz McCargo here, so we were able to turn her onto some of the CE mark products that we found that may be useful in the UK, and other hospital-sized ventilators that were coming out of China and Taiwan. And then found that, you know, there's only one ventilator per 100,000 people in Africa. So how do we start now turning that supply chain towards Africa as well? And similar to what Bruce was talking about, I come from Philips, one of the larger CPAP makers. So how can we convert those products where you can't have an intubation, you know, system set up for patients because they don't have the clinical workforce to make that happen? Use non-invasive products to do what he called quasi ventilators with CPAP machines. All very important activities. And that spun into programs around back to work, back to school. As we started working with the CDC on a more regular basis, we meet with them at least once a week, looking at what the gaps are in both the guidance and in moving that guidance out to the public. We could become an alternative chain for both communications, but also forming discussions. We pulled together a very large roundtable of a lot of those corporates I just mentioned, when we noticed there was a big gap in the guidance around testing for employers. How does testing work? Well, these large companies had the resources, both legal and human resources and others, to really start to tackle that problem. So we built a kind of an internal roundtable to have those companies start to share their experiences in building those policies. We did a quick review of the Fortune 100 plans and put those on our website. So you can go to our website and see the planning for you know, just getting back to work listed with links to their plans, so we could share those quickly since there was a gap in the guidance from the CDC. As they started, we also fed that back to them. So as they started rolling out their testing guidance, they had some input from what the public or private sector was doing. And we did the same thing in back to school. So in looking at the back to school guidance, how do we take that and focus it on one school's experience? So we chose a school, KIPP Academy, in the inner city of Atlanta. serving an underprivileged neighborhood, and said, what would it take for them to actually implement the back to school guidance? And we're still working that project, but we've also been joined by Verizon, Microsoft, and Dell to look at how technology can also play a role in getting back to school. What other support systems are there? Omnia Partners, another big supplier of equipment, joined to build kits for the kids to take home. And then how do we compare that response with what's happening in, let's say, the UK or the Netherlands? So that's where I met Carrie Ann from the British consulate, and she introduced us to the folks at the NHSX on what their tracking and tracing program looked like and how their pilot went, what information gathering was available, and how do we compare what's happening in other countries to the response that we have here in the US, and can we take those learnings and move them in both directions? So how do we coordinate the assets and move them forward?
I think that's really an interesting outcome of all this, is that, you know, we talk about the geopolitical competition aspect of it, but there's really so much collaboration going on, probably in an unprecedented, extent, you know, with all these different these vaccine collaborations and best practices sharing across various countries, et cetera. I wanted to ask Ben Harris, because I know, Ben, you specialize on the supply chain side, and we talked about the fact that these devices or products are often regulated, and that there's been sort of a shift in mindset, if not, you know, massive production capacity toward getting, you know, more of these sensitive or, you know, important products back towards this side of the world, especially in light of our kind of competition with China. So can you talk about some of the supply chain issues that companies may be running into, or you know, it's sort of been the Wild West in a way for getting PPE here?
I think you hit the nail on the head there, Trevor. I think Ken and I have definitely had an interesting time, depending on, you know, when we were talking about this, and with him and his team. It's been this evolution, because there really was no mature, you know, supply chain here for PPE at this time. All of a sudden, it's like they just turned the faucet on, and it was kind of like, just go figure it out at this point. You know, each employer had their own way, you know, whether they were already working with a large supplier like an AmerisourceBergen or a McKesson, Cardinal Health, you know, some of the big wholesalers out there. Then all of a sudden, a lot of them were on allocation at one point, and even some of the larger companies out there couldn't get the PPE that they needed, and especially some of the critical folks, you know, on the front lines had a really tough time doing that. So with that entire supply chain being overseas, you know, 90% of it really produced out of China, it created a lot of bottlenecks. And to your point, Ken, that you talked about earlier, about that problem only being exacerbated by the capacity issues that were happening from overseas. On the air cargo side, as you know, of course, air freight is the predominant form of supply chain, you know, for things that need to get here quickly from overseas, as opposed to ocean freight. So a lot of that was bottlenecked because of that, and of course the capacity that was cut on passenger flights inbound coming from China here to the U.S. market. So as large airlines continued to cut capacity due to a lack of demand on the passenger side, the same thing was going to happen for belly cargo as well. There was of course, a resulting cut in capacity there. So there was a huge bottleneck.
Explain what belly cargo is for those of us that may not work in logistics.
Sure. So you think about when we board flights, and we have companies like Delta and other airlines that ask us to bring our own bags aboard and not pay that $50 fee. They want to reserve more of that space there in the bellies of the planes, where they can actually reserve that space for cargo, and cargo that's actually they're making revenue off of, as opposed to our clunky big bags that just add weight basically to the tickets we've already purchased. So there's definitely some competing interest there, of course, for that. And it makes sense from their side. But that's really the predominant way that we see air cargo travel, is through the bellies of passenger aircraft. So of course, again, going over the capacity constraints that we had around on the passenger side, that created a bigger problem here. So to Tiffany's point earlier, you know, a lot of the coordination was around, you know, how do we continue to work with partners on bringing over, you know, getting enough allocation on those flights, and getting even dedicated freighters, large, we talked about UPS earlier, large dedicated aircraft just for PPE. We had companies like Flexport and UPS that were bringing over their own planes full of PPE for various companies here in the U.S. And that really brought about a big change in, how can we maybe produce here domestically so that we don't have those same supply chain issues.
Yeah.
Yes. Trevor, a quick question. Since we're talking about supply chain and in particular cross-border supply chain, and since we have so many representatives from foreign markets on the call, I was wondering if anybody from the corporate side or from the representatives of the foreign markets ran into any issues that invariable might result on the crosses to the foreign policy side, meaning were there any issues? We talked about bottlenecks, but that, again, those have to do with capacity, supply chain, but from the political side, on the foreign policy side, were there any issues that needed to be resolved or circumnavigated, if you will, in order to comply? At the beginning of the crisis, we heard all about some of the countries putting restriction on what they could export, and for us will be import or vice versa. So I was wondering if anybody has any experience with that.
Yeah, I think Bruce wanted to go ahead and start on that.
Yeah, so what we actually did, Jorge, and what we had to do is, unfortunately, we were able to leverage our French Atlantic connection, and that is that many of our components, and in fact some of our materials, we source out of China, and we were having difficulty in getting it from China to the U.S. On the other hand, we were able to get it from China to France, and then subsequently from France to the U.S. So we actually were able to create a across the ocean, both Pacific and Atlantic, to get what we needed, and it was mostly materials and components. But what it also did is it convinced us that, given the fact that this did put supply chain challenges on a lot of what we were doing, is we had to get out of the mindset of having all your eggs in one basket, and whether it be all our manufacturing in France or manufacturing in China. So we have been exploring manufacturing opportunities in the U.S. or at least in the Americas, so that we can be a little bit more self-sufficient with activities that we are doing in the Americas. But at the present time, I would say the bulk of our manufacturing is in France, and we do have a continuous stream from Europe to the U.S.
Yeah, I think that's interesting. It's the idea of people say right sourcing or whatever versus outsourcing versus reshoring and all that. It's a matter of creating a overall plan that works versus being in necessarily one place or another, I think. But I'd love to hear, I think Guy, sure, I think Guy wants to ask something, but then go to Barbara.
No, actually a comment, and that kind of struck me as Bruce was speaking, and then again with Barbara. When I was with the American Israel Chamber, our first telehealth conference was, I think, in 2009. We were talking about, it was when John Oxendine was the Commissioner of Insurance, and they created the Georgia Partnership for Telehealth. And people have been doing and thinking and playing with it for, let's say, 11 years now. And then something came up, and we had to do it in 2 weeks or three months. Same thing as getting a product out to market, like Barbara said, within 7 weeks, which is unheard of, but apparently it's possible. And I think, again, my thought or my question or my whatever is that, is this going to be the new way that people are going to develop? Is that going to be the new thinking in startups? Said we need to get to market in 7 weeks, and who cares about all the processes we've spent 2 years on? Is this going to be the new normal, or are we going to go back to the way that, oh, let's sit on it for 11 years and then see if we can make it happen?
Yeah, that's a good question.
I would say short answer is yes, we hope it's the new normal. And you're right. What we did is we eliminated a lot of the dead space in overanalyzing and decision making. And to your point, Guy, is that we were in a situation where we had to quickly come up with telecommunication connections, and we were able to do it in a matter of a month. Whereas traditionally, and knowing some of the things that we've done in the past, it could have taken a year.
Yeah. Barbara, what did you want to say on that? Or before?
Yeah, going back to the original question, first of all, one thing that we've done, that the Sigvaris group has done, is all of our raw materials, our yarns that we make our products, are sourced from the U.S. So that's always been a company goal, is that we have kind of a very, very country specific strategy. So when we designed the face mask, the cloth face mask, one of our limiting factors was we had to use existing materials that we already had a supplier for in the U.S. We had to use existing packaging materials, again, that are supplied within the U.S. So we were able to do this without any type of cross-border issues. One thing that did come up, however, is the FDA did a great job. We're a medical device manufacturer, so we're FDA controlled. They did a great job in sending out guidance around face masks very early on in March, that helped us, be safe about, making a mask and selling a mask and not worrying about somebody coming and having a legal issue with that. But I noticed there was a few people in the group from Canada, and because I'm in charge of North America, we also are trying to sell the face masks in Canada. Canada's government did not do the same thing that the FDA did here in the US. And so we had to try to get liability insurance in order to sell face masks in Canada. It has taken me 2 months to try to get somebody to write insurance for us to sell face masks in Canada. We finally got it done, but it really, really slowed down the process. And I think that the government in Canada didn't react fast enough and kind of follow the FDA's guidance on this. So we just got approval. We will be shipping them up there, and they will start selling them next week. But that was unfortunate that we had to delay. So I just wanted to share that with the team because, I did notice a couple people from Canada here, so maybe they can take that message back and that can be helpful for them.
Absolutely. I mean, I'm happy to set up, this is Prabhu at the Canadian Consulate. I'm happy to set up a call with you afterwards between you, me, and Maddie Cook, who does a lot of the work on the healthcare side of it. And we can maybe talk about how we can improve the processes further the next time around, because there's probably going to be a second wave, I assume. So we'll have to prepare for that. So let me reach out to you offline and set up a call with you maybe on Friday. Okay.
Yeah,
that brings up a great point that's been brought up in one of our questions by Dr. I think Berku as well, which is that there is, as fast as we want to get things to market, to Guy's point, there are often there's that dead space is often not created by the company, it's created by government regulation, and the more you get into cross-border business and collaboration, the more you kind of run into that and face these limitations. I wonder if we could bring in some of our binational representatives here, maybe from the chambers or the trade offices, or even Peter from the Swiss consulate. If y'all wanted to talk about how you're kind of advising companies to deal with some of this regulation, but also take advantage of some of the opportunities. Maybe we start with Peter. And Dr. Berku was mentioning the fact that his phrasing was that there's still conventional barriers to innovation, where we need to entertain out-of-the-box ideas on what the future of medicine should look like. He was talking about legal issues in particular, but also reimbursement, right? When you can't get the payment for the products or the services to match the speed of the innovations that are happening, that becomes a problem. But Peter, why don't you start from the Swiss perspective?
Yeah, thank you very much, Trevor. This is one of the moments where I'm happy, proud to be a Swiss, listening to Barbara's talk. Yeah, and I mean, this stands also Sigvaris is an example of the strength of the Swiss industry, of the innovative strength of Switzerland. There are quite a few other collaborations between Swiss companies and the United States. I just want to mention maybe quickly Roche Diagnostics, who shipped tests to the USA, or Moderna, who has a contract now with the contract drug maker Lonza Group, or also Firmenich, who increased its production capacity of hand sanitizers for hospitals, as also across the United States. So this shows that the cooperation is actually possible, and cooperation between Switzerland and the United States is really happening. And I must say, I have not heard of really a problem coming up. What my concern is a little bit, looking at some nationalist and protectionist tendencies all over the world. I'm not talking about the United States here specifically. It's really, you see this all over the world, in Europe, in Asia, and here in the Americas. These national protectionist tendencies should not become an obstacle for a fair distribution of, of a potential vaccine, for instance. I see there is a run and a race towards obtaining such a vaccine, and I really see some problems might come up in the distribution worldwide. And how can we act, or what can we do in order not to, to take advantages too much from one side or over the other?
Definitely. Thank you, Peter. So we are right at 12, actually a little bit after. I sent a chat, but if y'all do need to jump off, then feel free. We're not
in a minute I will have to leave.
But I do think we have some other binational perspectives to get. Maybe Rami, I don't know if you want to speak from the French side.
I just want to say we're going to keep the bar open, and I'm saying we're going to keep the bar open till the last person is here, and if you need to jump off, then thanks for participating, and see you on the next one.
Definitely.
Thanks,
Rami, did you want to chime in from the French side? Can I unmute? And then we'll get the Brits in here. I think that'll be good. if we still got them here. Let me see if I can unmute you, Rami.
Unmute, okay. Can you hear me?
Yes, yep.
Well, first I wanted to thank all the speakers for the great intervention. From the French side, I just wanted to say, maybe, many of you know already what's going on, but even though the crisis is going on and many priorities are there regarding unemployment, but still entrepreneurship, technology, and science development is still a priority, and there will be money injected toward developing this and not letting entrepreneurs, let's say, drop in their startup development. So France is also eager to develop partnerships to face the crisis with international partners. So this is one thing, and we're if I just want to send this message because I need to run. If anyone in this thread is interested in developing further partnerships with France, profiting from the funds that are available there, I'm very happy to chat with all of you.
Great, thank you so much. And I think Ani, did you have one more question? I think we'll kind of wrap it up after this question because we're having people drop off. But Ani, you wanted to ask something?
Yeah, my question is to all the speakers that, COVID-19 presented an unparalleled situation in recent modern history of 100 years or so. So at least in US, all the government, FDA regulations and all those things is a go, get it produced, and start. So as Barbara said, and other speakers also said, you were allowed to bring products in weeks. But how sustainable those products are going to be when the market forces, when the situation normalizes?
Yeah, that's a good question.
It's like, I mean, there's plenty of money which government threw, whether it was late or not. But what happens when the market forces start playing? Will you be able to compete on a global scale or on a national scale?
Tiffany, I think that's a good one for you.
I can jump, and then I have to jump. I apologize, but so yeah, I think that's the big question mark here. Is a lot of these things have been allowed under relaxed guidelines and emergency use authorization, and that's for right now. It's going to go away, and so people are still going to have to follow the right processes and procedures. And so that's where we really tend to caution people from entering new markets. Unless they're in it for the long haul, because you can, to Barbara's point, liability insurance and legal issues with FDA, nobody wants to deal with that. And so, I would encourage everyone, as we're innovating through these global pandemics, to do it with quality in mind. Yes, we'll be able to go quickly, but really balancing short-term market opportunities and long-term market opportunities. And now we know, right? And so to the extent that we can be proactive now and thoughtful about who wants to participate in this sector, and then making sure all the right people, documentation, relationships are in order so that you can pivot and go fast. But thanks for including me. Feel free to reach out, anyone, if you have questions or other comments, and thanks for the invitation.
Okay. Yeah, Bruce, before you start, I wanted to actually direct this one to you anyway. Dr. Berku was asking about the issue of medical license and doing digital health across state lines, for instance, and how that may be representative of legal issues that people did not foresee, and maybe are some of the reasons why we haven't adopted these solutions sooner. And in a time of crisis and emergency, to Ani's point, we've relaxed the regulations on things, but how sustainable is all this, and how do we have to change our thinking, I guess?
Yeah, no, actually that is a good question, Trevor, and I actually was going to allude to that. First, Ani, to answer directly your question, is that we were faced with an important strategic decision as we were bringing some of our devices to market, particularly in the U.S., to address needs, and that is, do we look at short-term entry or long-term sustainability? And what we worked with the FDA and actually in Europe as well for CE marking was a sort of a hybrid or middle ground. And that is that if we got things brought in on emergency use, they can only be used in emergency use purposes. And once the emergency is deemed to be over, so to speak, the product can no longer be used. And in fact, as we were told, is most of the data cannot be used in terms of getting further review. So you would essentially have to start the process over. On the other hand, what we did is we made sure that the devices that we brought in met the expectations criteria, and we actually did file for FDA and CE mark clearance, but in an expedited review fashion. So that recognizing the importance and the need, it went through the traditional process, but even the FDA itself and in Europe recognize that there are certain processes that can be somewhat accelerated without compromising quality. So we went for the long-term sustainability, but in a way that we can get a rapid review. Trevor, to your point in terms of telemedicine, that in fact was probably the most significant change that we saw in terms of cross-border license allowance. And that is that, in fact, I looked as recently as yesterday to see what the current statistics are, and 49 of the 50 states do allow that cross recognition, so to speak, of licensing. I don't think anyone has a crystal ball to detect whether this will be sustainable or not, but often some of the things that you introduce are hard to take away. And as more and more are getting comfortable in using telemedicine, it may in itself create a whole different environment. So I could not predict and say, are we going to go back to normal and say that you are constrained within your boundaries? But there may be somewhat of a hybrid again in the future. The problem that we are recognizing is that the physicians who do participate in telemedicine do, of course, have to be insured, malpractice. And malpractice does have its own set of rules in terms of state boundaries. So if I had to project, I will say states will never is a strong word, but states are unlikely to give up or abdicate their control over individual state licensing of physicians. I think that will always be maintained. However, the ability to participate remotely may in fact be loosened. And as we look today, where it does allow 49 state cross coverage, I think that in the future we're still going to see a majority of those states maintain that openness, and it's just again to allow access for patients.
Yeah, that'll be fascinating. You know, it's been written quite a bit during this crisis that, you know, times like this accelerate change, and especially technological change in ways that, you know, sort of peacetime or normalcy does not. So it'll be interesting to see what's lasting and what's not, and
Trevor,
how we navigate these things.
I just wanted to add one comment, if I could. I know we're running short, but you know, talking about short-term entry versus long-term sustainability is a really good topic. What we found is, you know, our strategic goal was not to sell face masks for the next 10 years. Our strategic goal was to meet an urgent need in the marketplace and learn from it. And what we've learned is that we have learned how to market a product digitally. Medical companies don't normally sell on Amazon, but you can buy our face masks on Amazon. And we figured that out in about 3 weeks. So I think there's long-term sustainability in the terms of how the business model is changing in the medical world. How do we reach our end consumers? And there's new ways for people to gain access to medical products rather than having to get in a car and drive down the street and go to necessarily a retail store. Now they can do things from their home, find things online, etc. So there's a lot of long-term sustainability. Even if the product goes away, the processes and the way we market has changed, and we're a much better company for that.
Yeah, I think that's a good point. And we didn't even really get into cross-border research and CRO activity and all that. Jorge, do you want to close this out?
Yeah. I just want to say, I think Jacobus is still on, and so is Tamir, on this topic that Annie brought up and Barbara just touched on, and Guy, is remember a conversation I had with Jacobus about how long GSU was thinking what to do on online courses, and then in a week or 2 weeks they really have to come on board with this. So maybe this will be a good topic to talk about, this thing that Barbara was just talking about, taking this to the next step on managing what's short term, putting processes away and speed to market and resolve issues, and some of the thoughts that where Ani was bringing up. But anyhow, on behalf, one of the things that I really like about this is that, and that's what we're all about, the purpose of this is to bring people to the table that can resolve issues, and what are the importance of those international connections. So Barbara, having had the Canadian consulate on board, or in any cases, or the French or any other market, to get to know who are the players and build those relationships is what Pendleton is all about, and the purpose of this call. So I want to thank everybody, and we look forward to our next conversation.
Thank you.
Thank you.
Thank you all. Have a great day.
Have a good evening.
We'll be in touch.
Good afternoon.
Bye-bye.
Bye-bye.